Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
For the hospitalized patient who is physically or mentally unable to care for himself, maintaining oral hygiene always presents a problem. Inadequate removal of bacterial deposits may soon cause the teeth to decay and the gums to become infected. It may then become necessary to provide emergency dental treatment for relief of pain or acute infection. This can be avoided by maintaining an adequate program of oral hygiene and preventive dentistry. Let us now look at a mouth that has not received proper care. The deposits on these teeth can be demonstrated by using a disclosing wafer consisting of a harmless vegetable dye. After the patient chews the wafer, the dye temporarily sticks to the deposits and shows where the bacteria are concentrated. When the gums become infected, these bacteria can get into the bloodstream and damage the general health. Let us take a look at these germs through the microscope. It is important that they be removed. Not only can they damage the general health, but they can multiply and eventually cause the loss of all the teeth. These germs, however, can be removed by careful brushing. With the use of a mechanical toothbrush, toothpaste, and a stable stannous fluoride gel, an adequate program of oral hygiene and preventive dentistry can be maintained. This toothpaste was developed for the astronauts and can be swallowed without harm. The gel, which is put on the teeth after they are brushed, increases the resistance of tooth enamel to decay. Both of these products were developed at the Veterans Administration Dental Research Laboratories in Houston, Texas. Here, an active research program is maintained to investigate and develop materials for the control of tooth decay and diseases of the gums. One of these products is the stable stannous fluoride gel that we have seen. It is prepared under carefully controlled laboratory conditions and then distributed to various centers for clinical evaluation. A second product, which was developed in this laboratory, is the Ingestible toothpaste. This paste is ideal for any group of individuals incapable of maintaining their own oral hygiene. It is also prepared under carefully controlled laboratory conditions and distributed for clinical evaluation. The development of the paste was first requested by the National Aeronautics and Space Administration for use by the astronauts, seen here in their capsule on the way to the moon. They use it twice a day during the flight. After brushing their teeth, they merely swallow the pleasantly flavored product as if it was food. It is the official dentifrice for the Apollo space program and has been used in the Apollo flights, including those to the surface of the moon. Here, we see the lem shortly after separation. This toothpaste and gel, together with the electric toothbrush, can be used in a program of oral hygiene and preventive dentistry. Each patient with natural teeth should have 2 soft bristle brushes for the battery-operated unit. They should be alternately used so that one will always be dry. Any patient, ambulatory or bedfast, who wears removable partial dentures should also have a separate brush for the dentures alone. These 3 brushes can be stored in the patient's bedside cabinet. For the total care patient who is unable to respond by opening his mouth, turning his head, or spitting, oral hygiene can be performed by the nurse or nurse's aide alone. After elevating the head of the bed and covering the patient's chest with a towel, the lips are coated with Vaseline. The end of a wooden tongue depressor, which has been wrapped with gauze, is inserted between the patient's teeth on one side. A mechanical gag, positioned between the back teeth on the opposite side, opens the mouth wide. A rubber bite block with a string attached for emergency retrieval is used to support the patient's jaw and keep his mouth open. The mechanical gag can now be removed. The patient's head is turned to one side to allow the saliva and fluids to pool in one area. A suction tip is used to remove the water as the mouth is rinsed. The tongue blade can be used to retract the cheek as the teeth are brushed. An orderly procedure of brushing should be followed to ensure complete coverage of all tooth surfaces. With the electric toothbrush, it is only necessary to have the bristles of the brush lightly contact the teeth. No brushing action by the nurse is required. After the teeth have been brushed on one side and in front, the gag is reinserted. It should be placed well back in the mouth. Opening the gag permits removal of the rubber bite block. The gag is then closed and rotated around to the other side. It should not be removed from the mouth to do this. The bite block is now placed between the teeth on the cleaned side. The gag is removed and all exposed surfaces of the teeth on this side are brushed. The wrapped tongue blade is again used as a cheek retractor. After brushing the teeth, the patient's head is again turned to one side, and the mouth is irrigated. Either the wall suction unit or a portable aspirator can be used. The teeth are now coated with the stable stannous fluoride gel to make the enamel more resistant to decay. 2 cotton applicators held together provide a convenient method of transporting the gel to the mouth. The gel is applied to all exposed tooth surfaces. It is pleasantly flavored and is allowed to remain in place. The mechanical gag is again used to open the mouth so the prop can be removed. With these two instruments, complete access to the oral cavity can usually be obtained in any patient who is unable to respond. The toothbrush is thoroughly rinsed under running water and returned to the cup to dry. The handle of the unit is wiped with an alcohol sponge. If a total care patient wears dentures, they should be cleaned regularly as part of his oral hygiene care. It is important, however, that the brushing be performed over a sink or basin containing water. Then, if the dentures are accidentally dropped, they will not be broken. The denture is thoroughly scrubbed with soap and water. It is rinsed, placed in the denture cup, and returned to the patient. Dentures may be left out at night and soaked in a denture cleaning solution to help remove stains and odors. For the total care patient who is able to respond by opening his mouth, spitting, or even turning his head, essentially the same procedures as have been demonstrated are followed. If the patient wears removable partial dentures, they should first be removed and cleaned. Although the mouth gag and prop are not necessarily required, they do make it easier for both the operator and the patient. The prop supports the jaw for the patient and provides access for the operator. The wrapped tongue blade makes a convenient cheek retractor. Again, an orderly procedure of brushing should be followed to ensure complete coverage of the teeth. The procedures used in this program of oral hygiene are effective and not difficult to perform. This supervised student nurse is being trained to perform these duties. Oral hygiene is an important segment of total health care. An excellent program of oral hygiene and preventive dentistry can be practiced and maintained for the total care patient by following the procedures demonstrated in this film.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.